Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A client with acute kidney injury, AKI, has a urine output of 15 milliliters per hour for the past 4 hours. What is the nurse's priority action? A. Encourage the client to drink more water. B. Assess the client for signs of fluid overload and notify the healthcare provider. C. Document the finding as expected. D. Administer potassium supplement. Correct answer: B. Assess the client for signs of fluid overload and notify the healthcare provider. Rationale. Oliguria is a hallmark of AKI and may indicate worsening renal function. Immediate assessment and provider notification are required. Question 2. A client with chronic kidney disease, CKD, has a serum potassium level of 6.4 milliequivalent/L. Which finding requires the nurse's immediate attention? A. Muscle weakness. B. ECG showing peaked T waves. C. Dry skin. D. Poor appetite. Correct answer: B. ECG showing peaked T waves. Rationale: hyperkalemia can cause life-threatening cardiac dysrhythmias. Peaked T waves are an emergency. Question 3. A client with CKD asks why protein intake is limited. What is the nurse's best response? A. Protein increases blood sugar. B. Too much protein increases waste products that damaged kidneys cannot remove. C. Protein causes dehydration. D. Protein raises blood pressure. Correct answer: B. Too much protein increases waste products that damaged kidneys cannot remove. Rationale. Protein metabolism produces nitrogenous wastes that accumulate when kidney function is impaired. Question 4. A client with AKI develops crackles in both lungs, edema, and shortness of breath. What complication should the nurse suspect? A. Hypovolemia. B. Fluid volume overload. C. Hyperthyroidism. D. Hypoglycemia. Correct answer: B. Fluid volume overload. Rationale: AKI commonly leads to fluid retention, increasing the risk of pulmonary edema. Question 5. Which laboratory value is most indicative of worsening kidney function? A. Creatinine 4.8 mg per deciliter. B. Hemoglobin 13.8 g/dl. C. Sodium 138 milliequivalent/L. D. Calcium 9.2 mg per deciliter. Correct answer: A. Creatinine 4.8 mg per deciliter. Rationale: elevated serum creatinine reflects declining glomerular filtration and worsening renal function. Question 6. A client receiving hemodialysis suddenly reports nausea, headache, and confusion during treatment. What should the nurse suspect? A. Dialysis disequilibrium syndrome. B. Hyperthyroidism. C. Pulmonary embolism. D. Hypoglycemia. Correct answer: A. Dialysis disequilibrium syndrome. Rationale: rapid removal of urea during dialysis can lead to cerebral edema, causing neurological symptoms. Question 7. A client with CKD is prescribed epoetin alpha. Which laboratory value should indicate that the medication is effective? A. Increased hemoglobin level. B. Decreased potassium level. C. Increased sodium level. D. Decreased creatinine level. Correct answer: A. Increased hemoglobin level. Rationale: epoetin alpha stimulates red blood cell production and is used to treat anemia associated with CKD. Question 8. Which assessment finding is expected in a client with advanced CKD? A. Hypertension. B. Polyuria with dilute urine. C. Bradycardia due to hypokalemia. D. Increased appetite. Correct answer: A. Hypertension. Rationale: CKD commonly causes sodium and water retention, resulting in hypertension. Question 9. A nurse is caring for a client with AKI. Which prescription should the nurse question? A. Monitor daily weight. B. Monitor intake and output. C. Administer potassium chloride. D. Assess serum creatinine daily. Correct answer, C. Administer potassium chloride. Rationale, clients with AKI often develop hyperkalemia. Potassium supplements may worsen this life-threatening condition. Question 10. The nurse receives report on 4 clients. Which client should the nurse assess first? A. A client with CKD who reports fatigue. B. A client with AKI whose potassium level is 6.8 milliequivalent/L and who has peaked T waves on the ECG. C. A client with CKD requesting pain medication. D. A client receiving dialysis who is waiting for breakfast. Correct answer, B. A client with AKI whose potassium level is 6.8 milliequivalent/L and who has peaked T waves on the ECG. Rationale, severe hyperkalemia with ECG changes is a life-threatening emergency because it can rapidly progress to fatal cardiac dysrhythmias. Immediate intervention is required. Question 11. A client with CKD is prescribed calcium acetate. What is the purpose of this medication? A. Lower blood pressure. B. Bind phosphorus in the gastrointestinal tract. C. Increase urine output. D. Treat hyperkalemia. Correct answer, B. Bind phosphorus in the gastrointestinal tract. Rationale, calcium acetate is a phosphate binder that decreases phosphorus absorption, helping prevent hyperphosphatemia in CKD. Question 12. A client with AKI has a BUN of 78 mg per deciliter and creatinine of 5.2 mg per deciliter. Which assessment finding requires immediate intervention? A. Metallic taste in the mouth. B. Pericardial friction rub. C. Fatigue. D. Mild nausea. Correct answer, B. Pericardial friction rub. Rationale, a pericardial friction rub may indicate uremic pericarditis, a life-threatening complication of severe kidney failure. Question 13. Which laboratory value is expected in a client with advanced CKD? A. Hemoglobin of 8.2 g/dl. B. Hemoglobin of 15.0 g/dl. C. Calcium of 11.5 mg per deciliter. D. Creatinine of 0.8 mg per deciliter. Correct answer, A. Hemoglobin of 8.2 g/dl. Rationale. CKD decreases erythropoietin production, leading to anemia. Question 14. A client receiving hemodialysis suddenly becomes hypotensive and dizzy. What should the nurse do first? A. Increase the ultrafiltration rate. B. Slow or stop ultrafiltration and assess the client. C. Encourage ambulation. D. Administer potassium. Correct answer, B. Slow or stop ultrafiltration and assess the client. Rationale. Hypotension is a common dialysis complication caused by rapid fluid removal and requires immediate intervention. Question 15. A client with AKI is prescribed sodium polystyrene sulfonate, KXylate. What is the purpose of this medication? A. Increase urine output. B. Lower serum potassium. C. Raise calcium levels. D. Reduce serum creatinine. Correct answer, B. Lower serum potassium. Rationale, KXylate removes potassium through the gastrointestinal tract, helping treat hyperkalemia. Question 16. Which assessment finding is most consistent with uremia? A. Pruritus, nausea, and confusion. B. Bradycardia and weight gain. C. Hyperactivity and insomnia. D. Increased appetite. Correct answer, A. Pruritus, nausea, and confusion. Rationale, uremia results from the accumulation of waste products in the blood and commonly causes itching, nausea, fatigue, and altered mental status. Question 17. A client with CKD asks why blood pressure control is important. What is the nurse's best response? A. High blood pressure can further damage your kidneys. B. It prevents hypoglycemia. C. It improves vision. D. It increases red blood cell production. Correct answer, A. High blood pressure can further damage your kidneys. Rationale, hypertension both contributes to CKD and accelerates its progression. Question 18. A nurse is assessing a client with fluid volume overload due to renal failure. Which finding is most concerning? A. Bilateral crackles and oxygen saturation of 88%. B. Mild ankle edema. C. Blood pressure of 138/84 mmHg. D. Weight gain of 0.5 kilograms overnight. Correct answer, A. Bilateral crackles and oxygen saturation of 88%. Rationale, crackles and hypoxemia suggest pulmonary edema, a life-threatening complication requiring immediate intervention. Question 19. A client with CKD is scheduled for hemodialysis. Which medication should the nurse question administering before dialysis? A. Water-soluble vitamins. B. Lisinopril. C. Stool softener. D. Acetaminophen. Correct answer, B. Lisinopril. Rationale. Antihypertensive medications are often held before dialysis because they can worsen intradialytic hypotension. The nurse should follow facility policy and provider instructions. Question 20. The nurse receives report on 4 clients with renal disorders. Which client should the nurse assess first? A. A client with CKD who reports generalized itching. B. A client with AKI whose potassium is 6.9 milliequivalent/L and who has muscle weakness. C. A client receiving epoetin alpha with a hemoglobin of 10.5 g/dl. D. A client with CKD requesting information about a low-phosphorus diet. Correct answer, B. A client with AKI whose potassium is 6.9 milliequivalent/L and who has muscle weakness. Rationale, severe hyperkalemia is a medical emergency that can rapidly cause fatal cardiac dysrhythmias. Immediate assessment and treatment take priority. Question 21. A client with CKD has a serum phosphorus level of 6.8 milligrams per deciliter. Which food should the nurse instruct the client to avoid? A. Apples. B. White rice. C. Cheese. D. Green beans. Correct answer, C. Cheese. Rationale, dairy products are high in phosphorus. Clients with CKD should limit phosphorus intake to prevent bone disease and vascular calcification. Question 22. A client with AKI is receiving 4-calcium gluconate for severe hyperkalemia. What is the primary purpose of this medication? A. Lower the serum potassium level. B. Protect the heart from the effects of hyperkalemia. C. Increase urine output. D. Remove potassium through the kidneys. Correct answer, B. Protect the heart from the effects of hyperkalemia. Rationale, calcium gluconate does not lower potassium. It stabilizes the cardiac membrane and reduces the risk of life-threatening dysrhythmias. Question 23. A client receiving hemodialysis has a newly created arteriovenous AV fistula. Which finding should the nurse report immediately? A. A palpable thrill. B. A bruit heard with a stethoscope. C. No thrill or bruit over the fistula. D. Mild bruising around the incision. Correct answer, C. No thrill or bruit over the fistula. Rationale, the absence of a thrill or bruit may indicate fistula occlusion and requires immediate intervention. Question 24. Which intervention is appropriate when caring for a client with an AV fistula? A. Measure blood pressure on the fistula arm. B. Draw blood from the fistula. C. Avoid venipunctures and blood pressure measurements on the fistula arm. D. Apply tight clothing over the fistula. Correct answer, C. Avoid venipunctures and blood pressure measurements on the fistula arm. Rationale, the fistula must be protected from trauma and compression to maintain adequate blood flow. Question 25. A client with CKD reports increasing fatigue. Which laboratory value best explains this symptom? A. Hemoglobin 7.9 g/dl. B. Potassium 4.2 milliequivalent/L. C. Sodium 138 milliequivalent/L. D. Glucose 96 mg per deciliter. Correct answer, A. Hemoglobin 7.9 g/dl. Rationale: reduced erythropoietin production in CKD causes anemia, leading to fatigue and weakness. Question 26. A client with AKI has fluid overload despite diuretic therapy. Which treatment should the nurse anticipate? A. Peritoneal dialysis or hemodialysis. B. Oral potassium supplements. C. Fluid bolus. D. High-protein diet. Correct answer, A. Peritoneal dialysis or hemodialysis. Rationale: dialysis may be necessary when severe fluid overload cannot be controlled medically. Question 27. Which assessment finding suggests a client with CKD is developing metabolic acidosis? A. Kussmaul respirations. B. Bradycardia. C. Warm, flushed skin. D. Hypertension only. Correct answer, A. Kussmaul respirations. Rationale: deep, rapid respirations are the body's attempt to eliminate carbon dioxide and compensate for meta. Question 28. A client with AKI asks why daily weights are necessary. What is the nurse's best response? A. They help determine muscle strength. B. Daily weights are the most accurate way to monitor fluid balance. C. They monitor kidney size. D. They determine your nutritional needs. Correct answer, B. Daily weights are the most accurate way to monitor fluid balance. Rationale: weight changes are the most sensitive indicator of fluid gain or loss in clients with kidney disease. Question 29. A client receiving epoetin alpha has a blood pressure of 182/104 mmHg before the scheduled dose. What should the nurse do? A. Administer the medication as prescribed. B. Hold the medication and notify the healthcare provider. C. Encourage exercise. D. Administer potassium supplements. Correct answer, B. Hold the medication and notify the healthcare provider. Rationale: epoetin alpha can worsen hypertension. Severe hypertension should be reported before administration. Question 30. The nurse receives report on 4 clients with renal disorders. Which client should the nurse assess first? A. A client with CKD who reports itching and dry skin. B. A client with AKI whose oxygen saturation is 86%, with crackles and pink frothy sputum. C. A client receiving hemodialysis who is asking about diet restrictions. D. A client with CKD who reports poor appetite. Correct answer, B. A client with AKI whose oxygen saturation is 86%, with crackles and pink frothy sputum. Rationale: this client is showing signs of acute pulmonary edema caused by severe fluid overload. Airway and breathing take priority, and immediate intervention is required to prevent respiratory failure. Comment your score out of 30 below. If this video helped you, don't forget to like, subscribe, and share it with a fellow nursing student. I'll see you in the next NCLEX practice session.